What are the latest flu diagnostic tests for pediatric patients? When it comes to diagnosing influenza in children, there are some exciting advancements in testing methods. The latest flu diagnostic tests primarily include rapid influenza diagnostic tests and molecular assays, specifically multiplex real-time reverse transcription polymerase chain reaction tests. Let's break these down. Rapid influenza diagnostic tests, often referred to as RITs, are designed to detect viral antigens from respiratory samples, usually taken from nasal or throat swabs. One of the biggest advantages of these tests is their speed. Results can be available in just 15 to 30 minutes, which is incredibly helpful in clinical settings. However, it's important to note that while RITs have high specificity, meaning they accurately identify those without influenza, their sensitivity can be moderate. In children, the sensitivity is reported to be around 45%. This means that a negative result does not definitively rule out influenza, especially since children often have higher viral loads. On the other hand, molecular tests, particularly multiplex real-time reverse transcription polymerase chain reaction assays, are considered the gold standard for diagnosing influenza. These tests detect the genetic material of influenza viruses and have high sensitivity and specificity. They can differentiate between influenza A and B viruses and even subtype influenza viruses, such as H1N1 and H3N2. These tests are increasingly used in hospitals and public health laboratories and can provide results within a few hours. This is particularly valuable for pediatric patients, as accurate diagnosis is crucial due to their higher risk of complications and the need for timely antiviral treatment. In clinical practice, nasal swabs are preferred for both RITs and molecular tests in children. This is because nasal swabs tend to provide better viral detection compared to throat swabs. There are also emerging rapid molecular tests that combine the speed of RITs with the accuracy of polymerase chain reaction tests. These are becoming more accessible and are improving point-of-care diagnosis in outpatient and emergency settings. For children and infants, accurate and timely diagnosis of influenza is essential. This is because they are at a higher risk for flu complications, and early antiviral treatment can help reduce the severity and duration of illness. Diagnostic testing plays a key role in helping healthcare providers decide on appropriate antiviral use and infection control measures. In summary, the latest flu diagnostic tests for pediatric patients include rapid influenza diagnostic tests, which are quick but have moderate sensitivity, and molecular assays, which are highly sensitive and specific. Emerging rapid molecular tests are also improving the speed and reliability of diagnosis. These testing methods are used alongside clinical evaluation to effectively manage influenza in children. Remember, no test is perfect, and clinical judgment remains important. Annual influenza vaccination is still the best way to reduce the flu burden in pediatric populations. Always consult healthcare professionals for personalized medical advice.